What we heard. In total, a combination of 219 individuals and organizations participated in the engagement process. There were 26 written submissions, 6 telephone, email, and text message submissions, 6 participants online for the public engagement session, January 30th, 2019. 102 participants attended the in-person targeted stakeholder sessions. Corner Brook, January 24th, 2019, 15 participants. Happy Valley Goose Bay, January 29th, 2019, 7 participants. St. John's, February 5th, 2019, 66 participants. Gander, February 7th, 2019, 14 participants. 79 participants attended the in-person public sessions. Corner Brook, January 24th, 2019, 13 participants. Happy Valley Goose Bay, January 29th, 2019, 6 participants. St. John's, February 5th, 2019, 58 participants. Gander, February 7th, 2019, 2 participants. All feedback submitted by the deadline of March 6, 2019 has been reflected. Participants in the engagement sessions followed the discussion guide and provided input on principles for the proposed legislation's foundation, accessibility barriers identified, other barriers and feedback for development and ongoing feedback of the proposed legislation. Principles. The discussion guide defined the following principles: accessible, barrier-free, citizenship, diversity, equity, human rights, shared responsibility, and universal design. Participants were supportive of all of the suggested principles. Feedback also indicated that the principles in any new accessibility legislation should reflect the United Nations Convention on the Rights of Persons with Disabilities, Convention, and principles should be clearly stated. Participants suggested the additional principles of accountability, the need for government to monitor, evaluate, and enforce new legislation. Inclusion. Some participants also identified inclusion as a standalone principle. Inclusion as a principle is often an extension of other principles. The end goal of the accessibility legislation should be inclusion for all. Personal choice and control. The need for individuals to exercise choice in all areas of their life and to avoid outdated practices of decision-making that impacts their rights. Communication. Ensure all communications are clear so that the information being shared is accessible and understandable. This includes timely communication that is transparent, available in sign languages, and accessible through the use of assistive technology. Collaboration. Stakeholders need to work together. This includes governments, municipalities, communities, businesses, etc. Silos need to be eliminated in order to increase accessibility. Quality of life. Quality of life should not solely be about meeting basic needs. Individuals live independently regardless of disability. It is important that the principles are clear, specific, and positive so that they are understood by everyone. Principles also need to apply to all disabilities. This will ensure that the legislation will consider people and not just their abilities, and that it will reflect forward thinking on prevention of barriers instead of reacting when barriers happen. Accessibility barriers. Accessibility barriers are anything in the environment that prevents a person from participating in day-to-day activities or in public opportunities. Identifying barriers enhances what is needed in the development of standards. The discussion guide listed barriers to accessibility with examples. These barriers were not listed in any specific order. Submissions and responses provided feedback on the barriers to accessibility. 1. Built environment barriers. Participants wanted to make sure it is clear that barriers that exist in a built environment are not only experienced by people who have physical disabilities, but by everyone across the lifespan. Universal design was emphasized by participants as an important tool to removing barriers in the built environment. Participants' input included: all public buildings need to be accessible with no exemption. There is a need for more than minimum codes, and enforcement being up to code does not always mean accessible. Lack of regular maintenance and signage impacts accessibility. Equitable emergency safety measures need to be implemented. Universal design must be considered at the start. Two, communication barriers. Communication barriers was frequently mentioned and highlighted as an often unrecognized barrier. Participants discussed how communication barriers exist most often for individuals who use alternate formats, such as real-time captioning and/or sign language interpretation. Communication barriers exist and often overlap with other identified barriers. Feedback included: barriers are encountered when text messaging is not a provided accessible option for communication. Information, including safety information, must be available in multiple formats. Public buildings should provide audio and captioning systems to communicate important information to individuals who experience communication barriers. 3. Barriers to education. Barriers to education were repeatedly linked with other barriers, including attitudes and the built environment. Participants shared that students experience long wait times for supports. An example, alternate formats of print text, even though it was felt that administrators are aware of supports needed in advance of the school year. Lack of assistive technology provided to students before, during, and after the K-12 system. Students must have access to assistive technology through their lifespan and not be taken away when they transition out of the K-12 system. Assessments must be wide-ranging, timely, and performed by an expert. Receiving an assessment should not itself be a barrier. Use universal design in learning as a tool to address barriers in education. Supports are necessary for effective transitions from secondary school into post-secondary system and work. Physical barriers to schools contribute to barriers to education. Students who are deaf experience barriers in learning from the lack of ASL interpretation and instruction, as well as from social isolation from their peers and teachers in the current inclusive education system. Reopen the school for the deaf to promote deaf culture and have tools and choices in learning sign languages. Educators lack the resources and knowledge to provide supports for some students. Four, barriers to employment. Barriers to employment were noted as having very significant and negative consequences on individuals' lives and participation in society, often linking these barriers to others. Identified barriers to employment include employers are not providing accommodation for employees, including current staff, new hires, and potential employees who have disabilities because of the fear of the cost of accommodation in a workplace. Other barriers increase barriers to employment, including barriers to education, transportation, and attitudes. Screening processes, including job descriptions, unnecessarily exclude people who have disabilities and do not account for accommodation. Employment programs often keep people with disabilities in entry-level positions. Fear on the part of employers in following standard human resource HR practices, including setting work expectations, create barriers for advancement. Supported employment was discussed as a currently successful means to realize equitable employment opportunities. Five, barriers in transportation. Transportation is important for accessibility and inclusion. There is a lack of accessible public transportation across the province. Specific barriers were the lack of audible stop announcements poses a communication barrier in transportation. The lack of considerations from a cross-disability perspective in accessible transportation. The path of travel to bus stops are not accessible. Rural accessible transportation is limited, expensive, or non-existent. Inappropriate use of accessible parking spaces and the lack of enforcement. Regulations for accessibility in various forms of transportation lack clarity and enforcement. Lack of equitable policies and procedures for persons with disabilities on provincial ferries. Inequitable access to transportation can create other barriers. An example, if a person does not have access to transportation, they can have barriers to access education or employment. Six, barriers in access to services and service delivery. Lack of access to services and service delivery barriers are often connected to other barriers: attitudinal, physical, communication barriers, and barriers within systems and policies. Examples provided include services at the Miller Center must provide peer support and access to current assistive devices and technologies. Lack of access to ASL interpretation for legal, banking, and other services across the province is a significant barrier for the deaf community. Rehabilitation services to support independence and lifestyle choices are needed. Lack of information on supports in medical care, an example, finding a family doctor. The facilities where services are located are often not accessible from a cross-disability approach. Healthcare, education, and other government staff are frequently not aware of the available resources and are unable to assist individuals with disabilities to navigate systems. Programs are too restrictive and do not ensure equity and personal choice. Services and programs are not inclusive of all disabilities, including people who have brain injuries. Having a cutoff for programs, services, and treatments once individuals reach 65 years of age creates unnecessary barriers. Asset and income testing should be removed from program eligibility because it creates barriers to accessing services and resources. Any barrier that is removed increases people's independence and choice. Seven, barriers to supported decision-making. Participants noted there must be an option for individuals and their families to collaborate and coordinate resources with government and communities to best serve an individual's need. Participants suggested a shared responsibility approach as a potential solution to address barriers in decision-making and legal capacity. The approach includes supporting persons with disabilities to live in their own homes in the community. It is a priority for participants, specifically because of aging caregivers. It ensures people with disabilities have the right supports to plan for their future and live in community. This is especially true for aging individuals, families, and caregivers. Additional feedback on barriers. Participants provided insight on other barriers such as everyday life participation, an example, political life, sports, recreation, leisure, and other interconnected barriers. Attitudinal barriers happen when individuals assume to know a person's abilities and needs or make assumptions without facts. This can present as a lack of respect. Lack of access to assistive technology in public spaces. Assistive technology can be financially inaccessible for many persons with disabilities. Evacuation plans, safety and emergency preparedness planning, and maintenance of public buildings do not include equitable safety measures for persons with disabilities. Financial barriers to accessing supports are experienced by persons with disabilities who are of low income or who live in poverty. Programs and supports are income tested and can be too specific to certain disabilities. People with disabilities who are on limited income have little access to participating in recreation and leisure. Government policies often do not consider all aspects of a person's circumstances. Some policies create disincentives to work. An example, removing needed benefits and supports to working people even when individuals are not making enough money to meet their needs. This affects their independence. Government policies may create expectations that individuals will rely on family and friends for needed supports. The public procurement process should follow accessibility standards. There must be requirements to prevent new barriers in new purchases and remove existing barriers in outdated infrastructure. Access to housing must be individually focused and support independent living. The use of universal design is a way to ensure access to housing across the lifespan. Specific barriers to housing include removing the medical care focus when supporting the transition from pediatric care to adult care, limited number of affordable and accessible housing options, attitudinal barriers from landlords, limited availability of accessible low-cost housing. Alternate care homes give financial controls to agencies instead of individuals. Recreation is seen as a nice-to-have for persons with disabilities and not a priority. There is a lack of access to recreation through the built environment, transportation to and from, financial barriers, and attitudinal barriers. A lack of access to parasport and assistive technologies to participate in sport and leisure was identified. Services and supports are not consistently available outside the Greater St. John's metropolitan area. Services are not consistent across regional health authorities. In addition, those living in rural and remote communities identified a greater need for accessible travel to access the limited services available.